So with that, I'm going to move to introduce Dr. Alan Garber. Dr. Garber is Provost of Harvard University, and he's Harvard's Chief Academic Officer. He's going to open the event for us. Provost Garber is also the Malincott Professor of Healthcare Policy at Harvard Medical School, a Professor of Economics in the Harvard Faculty of Arts and Sciences, Professor of Public Policy in the Harvard Kennedy School of Government, and Professor in the Department of Health Policy and Management in the Harvard T.H. Chan School of Public Health. As an economist and a physician, he studies methods for improving healthcare productivity and healthcare financing. And I'm very, very grateful that he's joining us, and I welcome you, Professor Garber. We can see you, and I'd like you to take it away.
Thank you, Louise. Can you hear me okay?
Yes, we can hear you great. Thanks.
Wonderful. Thanks so much. First of all, let me add my welcome both to the people who are present at the faculty club. I had hoped to join you, but couldn't today. But I'm also delighted that, as Louise said, there are more than 1,200 people participating online. So I imagine that for those who are online, it's many different times a day around the globe, wherever you're found. And I particularly want to thank the people who are participating at inconvenient hours for you, wherever you are. It's a real honor for me to mark this occasion as the first Global Health Symposium put together by the Harvard Global Health Institute. Let me just say, by way of background, that the Global Health Institute at Harvard was created for a fairly specific reason. There, as many of you know, there is a lot of activity and has been a lot of activity in global health throughout the university and its affiliated hospitals over the years. And I think that Harvard is a microcosm of what we face around the world. That is, how do we harness the talents of the many individuals who have a passion for global health and bring them together most effectively? How do we foster partnerships that will magnify our impact? And within Harvard, I think you would all be quite aware that we have a lot of global health activity in the hospitals, in the T.H. Chan School of Public Health, and in the medical school. But not everybody appreciates that the interest is far more widespread, including places like the Paulson School of Engineering and Applied Sciences, the Graduate School of Design, and the Kennedy School. Almost in every corner of the university, there is a passion to address the open challenges in global health. The Harvard Global Health Institute has had the great advantage of having some excellent leaders. From the beginning, it was Sue Goldie from the School of Public Health, followed by Ashish Jha from the School of Public Health, Alan Brandt, with appointments in the med school and the Faculty of Arts and Sciences, served as more than an interim faculty director, and helped to put the Global Health Institute on a very promising new path. And the culmination is the appointment of Louise Ivers, who has connections throughout the university and through the world of global health. I emphasize the connections because I think this is a huge part of how you achieve success in this area. Louise, for those of you who know her, will agree, she seems to keep more balls in the air than is humanly possible and does it with incredible grace. And she brings a passion for global health and dedication to research and education. That's going to shape our activities for many years to come. Turning to the conference, its theme is Global Health Equity through Community Engagement. This reflects the ethos of the Global Health Institute, and it challenges us to think how we can partner most effectively in addressing some of the world's most important problems. An important task is to bring diverse human talent to bear on these importance. Within the academic realm, we usually speak about bringing together multiple disciplines and types of expertise, everything from epidemiology, immunology, entomology, economics, anthropology, and clinical specialties like infectious diseases, primary healthcare, obstetrics, surgery, ophthalmology. We also need to bring together people around the world who have very diverse perspectives and experiences. The resourcefulness, dedication, and expertise of researchers, field workers, and clinicians in the parts of the world that bear the greatest burden of the many global health maladies, like infectious diseases, malnutrition, child disease, inspires us and reinforces the importance of reaching wide to develop partnerships that will enable us to take on the most important challenges. The range of speakers and other participants here today, whether in person or virtually, illustrates the spirit of interdisciplinarity and international collaboration we hope to foster. Now, again, we are an educational institution. Teaching and learning are at the heart of all we do. We're not only working with external partners to try to address these important global health issues, but also educating students on our own campus and elsewhere, starting with our undergraduates. Global health and health policy is what's known at Harvard as a secondary field concentration. It's sort of like a second major for our students. It's achieved remarkable success within our college. It's one of the most popular secondary concentrations, usually the first or second most popular, and it attracts students from all backgrounds. The success of the program just demonstrates the tremendous hunger that our students have to get involved in global health. I can't help but think of how many more students pursue careers in global health because they were exposed to this program and others that we have that are offered through the Harvard Global Health Institute. We're committed to giving our students the tools and resources they need to become the next generation of global health researchers and practitioners. And we hope we can contribute to the training of students elsewhere in the world. We recognize the importance of combining service and research in teaching, and we hope to impart this in our students. In keeping with the symposium's theme, our speakers will be touching today on some of the world's most pressing global health challenges. They include building equitable partnerships to address HIV inequalities, the value of planetary health in addressing the needs of the most vulnerable populations, defining a community-based response to emerging infectious disease outbreaks. As you can see, much of the symposium is about unfinished business, as it should be. When we think about the enormity of the problems we need to address, it is easy to appreciate that we need a wide range of skills. I like to think about our late, much beloved colleague, Paul Farmer, and the lessons that he taught us. We all remember his combination of dedication, brilliance as a researcher, commitment as a clinician, resourcefulness, and creativity. I think we should all remember as well how he made us laugh. He never let up in his determination to help the world's most vulnerable. And despite disasters, both natural and man-made, and the pervasiveness of the disease, trauma, and death that he encountered in his work, he never lost his sense of optimism. We can do this, and we can do this together. We should all remember that despite the remaining challenges, there has been great progress in global health in recent decades. The much greater control of HIV disease, declines in maternal mortality, and improvements in child health have demonstrated that success is possible. AIDS-related deaths around the world have declined by 68% since the peak in 2004 and by 52% since 2010. And between 2000 and 2020, the maternal mortality ratio dropped by about 34% worldwide. We have much more to accomplish, and we must not desist in our efforts. But remember that even incremental improvements can represent thousands of lives saved. Let us harness our talents and dedication to continue on the path toward better health throughout the world, better serving our least advantaged communities. With that, I want to thank you again for being here with us today. And thank you to our partners, our speakers, all of you in the audience, and to Louise and her team for putting together such a compelling program. I hope that you will find this inaugural Global Health Symposium to be both enjoyable and illuminating.